I'm Joe Alton, MD, also known as Dr. Bones of www.doomandbloom.net, where you'll find over 700 post videos and podcasts on medical preparedness for any disaster. Together with my wife, Amy Alton, a nurse practitioner, and my bird, TD Bird, America's favorite squawk box, we're the authors of the 3-category Amazon bestseller, The Survival Medicine Handbook, the New York Times bestseller, the Ebola Survival Handbook, and even the designers of the new board game, Doom and Bloom Survival, a fun and challenging way to get the whole family off their smartphones and thinking about preparedness. Now, I spend a lot of time talking about patients with this ailment or that injury, and today I'd like to talk about you, the medically responsible person for your family or group. How does a medic avoid becoming the patient? And as a caregiver, what can you do to protect your health? Most medics are concerned about contracting infectious disease, most of which will be respiratory in nature. Most infectious respiratory disease can be minimized by good respiratory hygiene. Sick individuals should cover their mouth and nose with tissues and dispose of those tissues safely. Use a mask if you're coughing. In many countries, by the way, it's considered a sign of social responsibility to wear a mask in public, especially if you're sick, in consideration of the health of others. Now, perform vigorous hand sanitation before and after contact with any of your patients. Warm water and soap for 30 seconds or so will do, or at least use hand sanitizers, even if you think your hands are clean. Get those gloves on. Use nitrile gloves if you're allergic to latex. Keep your contagious patients at least 4 feet away from anyone else who does not have the same illness. Use disinfectants to decontaminate all work surfaces. Maintain isolation in your sick room. Now, this advice I just gave is only useful to prevent you from becoming sick. It's not meant to keep you, the healthcare provider, well. Now, here are some standard recommendations by the medical establishment for caregivers to maintain wellness in normal times, plus my opinions for survival situations. Eat a balanced diet. Not too hard to do in normal times if you put your mind to it, but not easy to do in tough times, even with a reasonable variety and quantity of food storage. Just make sure you do eat. It's easy to forget when running from one patient to another in hostile settings. Get plenty of rest. Cutting down on the coffee may do it for you in good times, but don't be surprised if you can't get 4 winks, not to mention 40 winks, in a survival scenario. Somebody's got to be up at night to keep watch for intruders and to tend the sick and injured. When you're actively caring for the sick, your other duties for the group should be suspended if you have enough people to handle part of your workload. Tired people don't have the best judgment, and it's best and wisest for your group to prevent you from becoming a zombie. Get plenty of exercise. You've heard that. A half hour in your aerobics class at the gym may be the ticket for you in normal times, but unless you're a Superman or Wonder Woman, you'll probably be exhausted just from the activities of daily survival, not to mention caring for the ill and injured. Be certain to know the difference between exercise and stress. Exercise prevents heart attacks, stress causes them. You'll probably be active enough just doing what you have to do to keep it together if things have truly fallen apart. Now, manage stress. That's what they tell you, right? Of course, stress today could mean a half hour of overtime, or maybe biting your nails over the latest episode of Game of Thrones or The Walking Dead. But in the uncertain future, don't be surprised if you consider the most stressful times in your previous life to be the good old days. Sometimes it's not a bad idea to set aside a short period of time during the day when you can obsess over all the bad things that are happening. Set a specific time for it, and when that time expires, stop thinking about it and do something else. Stay active by performing chores that keep you in contact with your fellow human beings. This might keep your mind off the fact that it's all gone to heck. Visit your doctor for regular checkups. Aha! I always say that. Well, pretty good advice even for young people in normal times, but in bad times, you will be the doctor, survival medic. So keep as close an eye to your own health as you do on those you're responsible for. Take a break from caregiving. Conventional wisdom says it's reasonable to accept that there's a limit to what you can do as a caregiver. You may feel overwhelmed by the tasks you're required to perform in both good times and bad times. Although you may not be able to go on vacation in a powered down scenario, you must plan out times during the day when you can collect your thoughts, or maybe where you might not have to think at all. Take some time to clean up, change clothes, talk to people who aren't delirious with fever or in a panic mode, and consider relaxation techniques like meditation, massage, even yoga. Now, most of the other advice I've seen concentrates on collecting phone numbers of police and fire departments, emergency rooms, and other things that might just be plain inaccessible in tough times. I'll bet, however, that you have some useful advice to add to my modest proposals. If so, feel free to comment in the comment box below. This is Joe Alden, MD, wishing you the best of health in good times or bad. Thanks for watching. If you like our content, follow us on Twitter at Prepper Show and on Facebook at Doom and Bloom or Survival Medicine Dr. Bones and Nurse Amy. Thanks again.